Let us look at the treatment for H. pylori infection. See, this actually is important pharmacology for pharmacology also. So pay attention here. So here we are talking about the treatment. What are we trying to treat? We are trying to treat duodenal or gastric ulcers which are symptomatic. The person has come to us and they are saying that they have problem. So what we will give is multi-drug regimen. We will not use a single antibiotic. Why? Because monotherapy is not useful, because these colonies are, they have reached this niche. So they are doing their best in that level. So to break that, we need a multi-drug regime. So the success of the treatment depends on the compliance of the patient and also the susceptibility of these bacteria to these antibiotics. Look at the drug regime. Here you have first line of triple therapy drug. See what you need to see. First you will give triple therapy drug. First you will give Omeprazole. Omeprazole is a proton pump inhibitor, right? And Clarithromycin antibiotic. And you can give Amoxicillin. So you will give these three for 7 to 14 days. Then you will check the urea breath. If it is after 1 month, you will check urea breath. You will give the medicine for 7 to 14 days. After 1 month, you will check the urea breath test. If the triple drug therapy has failed, that means the urea breath test is positive, you will go for a quadruple drug therapy. In quadruple drug therapy, you will give same Omeprazole plus Bismuth subsalicylate, Metronidazole, the same thing which we had given here, right? Metronidazole, right? Tetracycline is added. Bismuth subsalicylate and tetracycline. Metronidazole is what? It is also an antibiotic, okay? It is also an antibiotic only. Fine. So again for 14 days you will give 4 of these. What does Bismuth subsalicylate? Bismuth subsalicylate is actually a bactericidal and hence it will become an antacid. Tetracycline is an antibiotic. So you will give these 4 for 14 days. Again you will do, you will check whether there is improvement or not. Fine. If it fails, that means urea breath test fails. Again you will do culture of the endoscopy guided, that is invasive. You will go invasive, right? You are going to go invasive now. And you will go do the endoscopy guided biopsy, and then you will also do an antibiotic susceptibility test, after which you will give the new drugs. Remember, for every lab diagnosis you should write antibiotic susceptibility test. We kind of forgot that in the previous videos to mention. At the end of every lab diagnosis, please write this antibiotic susceptibility testing. Okay. Let us summarize here what we have learnt. We will give treatment for H. pylori infection. Basically, it will be multi-drug. We don't want to give individual drugs because there is a lot of colonization. So let us start with triple what is that? Triple drug therapy. Under triple drug therapy, you have Omeprazole, which is a proton pump inhibitor. You have Clarithromycin. Then you have Metronidazole. Or you can give Amoxicillin. If this fails, this actually you will give for 7 to 14 days, okay? After 1 month only you will do the urea breath test. If that fails, then you will give the quadruple drug therapy, in which you will give Omeprazole. Instead of Clarithromycin, you will get Bismuth subsalicylate, which is a bactericidal agent, and you will also add the 4th drug, that is tetracycline. This again you will give for 14 days. Again, if there is failure, you will do a endoscopy guided biopsy, get the tissue, and then you will do an antibiotic susceptibility testing to know which drug might work. Is this much clear? Okay, good.